They both start with the same raw materials, have the same labor force. One, however, takes a lot more managers for whatever reason that micromanage the work, the laborers, okay? So there's an extra cost there. Which one costs less? The one, of course, that has more efficient management, right? Makes sense. Inefficiency waste is represented by the higher degree of management or overhead that is absorbed in the other facility. So how does that apply to healthcare? Well, we have two healthcare systems in North America that are both first world healthcare systems, recognizably very much alike. Hospitals look very much alike. Medical and nursing training, very identical. Doctors and nurses cross the border and do equally well in both countries. However, you know, if you go into a hospital in Canada, you won't know that you're in something different than what you were used to here in the United States. They look very much alike. The difference, however, is the overhead, the administrative cost of billing, et cetera, in the United States is 3 times as high per capita as it is in Canada. So there's a difference of an inefficiency waste of $400 per person in the United States. Our inefficiency waste costs us about $400 billion per year in the U.S. So you add those two together, and we're wasting, between quality and inefficiency waste, about $1 trillion a year out of a $3 trillion budget. In fact, I told you already that $1 trillion, that's the out-of-pocket money, right? That's the same amount our employers and we put out from our own private pockets. A lot of money. If we were to be able to get rid of all that waste and drop back, we could take the current rate of taxation, which is already world-beating, right? And with that alone, we could cover everyone for a high-quality care, because we wouldn't have the inefficiency and quality waste that we currently do. Wouldn't that be what we should be talking about in terms of reform? Isn't that what we should be going after, and not coverage?